Good morning to all and welcome to my slide. I, Srimati Renuka Das, Vice Principal IC, College of Nursing, VIMSAR Burla. Nowadays, COVID-19 have taken a considerable place or problems which is worldwide problems. Therefore, as a health personnel, nursing officer, all should remember it and accordingly provide the care of COVID patients. Today, our discussion is how to take care and prevent the complications of COVID-19 patients. SARS or COVID-2 is a novel virus and it has perturbed the medical science and has become a puzzle in terms of mutation, rapid spread, clinical spectrum and wide-ranging complications. In India, second wave of COVID-19 has created war-like situation. Again, though 15% required hospitalization, long-term complications bring about human suffering, sickness and affect quality of life of the people. In this context, management of complication assumes significance and role and responsibility of nurses or nursing officers in providing care which is very challenging to them. Here you see there is a COVID-19 positive patient in COVID hospital VIMSAR Burla which patient is in ICU unit. The COVID-19 complications. Those are invasive mechanical ventilation, ventilator-associated pneumonia, venous thromboembolism, catheter-related bloodstream infection, pressure, stress, ulcers and gastrointestinal bleeding, ICU-related weakness. Then, invasive mechanical ventilation. We will discuss one by one. Daily assessment of readiness. Then, to breathe spontaneously, it is the involvement of an instrument by mechanical ventilation. We should know that it is the involvement of an instrument inside the trachea through the mouth, such as endotracheal tube, or the skin, such as a tracheostomy tube. So, the patient is kept through mechanical ventilation by insertion of ventilator tubes or circuit. Then try your level best for daily assessment. Daily assessment for breath spontaneously and mechanical ventilation, intact respiratory muscle tone promotes expansion and chest wall and during the end expiration. The diaphragm may actually contract during expiration. Then it is assessed by the doctors as well as the nursing officers. Then if the patient's condition improves, the tube is extubated or removed. Then observe for pneumothorax. The pneumothorax is vary from mild to life-threatening, like shortness of breath, chest pain, which is very sharp chest pain, blue discoloration of skin, lips, tachycardia, tachypnea. It is called also collapsed lung. As a nursing officer, you have the most responsibilities to assess it and inform the doctor immediately, and accordingly you care the patient. Then minimize continuous or intermittent sedation. How will you minimize? By the advice of doctors. Then according to assessment of doctors, the sedation is reduced if the condition of the patient improves and the patient starts for a spontaneous breathing. Then allow patient for different method of communication. There are different methods of communications, Allow patient for different method of communications like verbal. If the patient is good condition, and to can also answer your questions. You ask something, then answer will be come from patient side. Then non-verbal, which is more than the words. Example, nodding the head, yes or no, wrinkling of the face, etc., which you can imagine that the patients still have pain if the patient's facial appearance changes. Then written communication. If the patient is literate, then try your level best to give the paper and pen to communicate by written. Then visual communication. By visual you can show the tablets or medicines, etc. These are the different method of communications. Then come to ventilator associated pneumonia. It develops due to patient's condition which the patient remains on the bed maximum time. So, oral intubation is preferable to nasal intubation in adolescents and adults. It is easier. Oral intubation is easier to perform, faster and less painful than nasal intubation. Under direct laryngoscopy to look out larynx and the tube go into the trachea to support for breathing. In COVID-19 cases with the complicated cases like pneumonia, emphysema, heart failure, collapsed lung, etc. So, in this case, in second phase, we will see the patient condition and keep the patient in semi-recumbent position. You see the figure or the picture, right side of the slide, the head of the bed, elevation 30 degree to 45 degree. So use a closed suctioning system. That means the suction will be performed in between to clean the secretions. Then periodically drain and discard condensate in tubing. Certain obstruction takes place due to continuous mechanical ventilation. So you clean the tube. New ventilator circuit for each patient. So you change the circuit and take the help of the technician there to discard the previous circuit and change the next another circuit to the another patient. So change circuit if it is solid or damaged but not routinely. If the patient is same, so you can be change the circuit if it is damaged. Then the next complication is here you see a COVID-19 patient in COVID hospital, VIMSAR Burla in ICU unit. The patient have kept in semi-recumbent position. So it reduces the risk of pneumonia. Then come to next complication, venous thromboembolism. It is the condition the blood clot forms mostly by thrombus or blood clotting. It always affects the deep veins. If the thrombus breaks off, it embolizes and flows towards the lungs due to immobilization and hospitalization of the patient. So, accordingly, you use pharmacological prophylaxis, that is heparin 5000 units subcutaneously BD for adolescents and adult without contraindications. If there is no any contraindications, there the group of medications are the tablet forms एनोक्सापारिन, बेमिपारिन, सेंटोपारिन, tinijaparin. These type of medications you can give the injectable subcutaneously, and sometimes if the patient's condition is good, orally it can be administered. It cannot bind both antithrombin and thrombin, so the clotting is reduced. Risk for this reason. Then mechanical prophylaxis, intermittent pneumatic compression. Then you see the mechanical prophylaxis intermittent pneumatic compression device. The patient have taken the device and using the device. That it is a technique or device you can imagine from this picture that include an air pump and inflatable auxiliary sleeves, gloves or boots in a system designed to improve venous circulation in the limbs of patients who have risk of DVT or pulmonary embolism. So, if there is available of this device, you also can use there. Then the next complication is catheter related bloodstream infection. Catheter related bloodstream infection is another existing problem or complications. It arises from central venous catheters. The incidence may exceed 10% and the mortality of up to 25%, and it increases hospital length of stay. So sterile precautions to be taken during the procedure. So the catheter, when the performing the central venous procedure, the catheter is given through peripheral vein or proximal central vein. Most commonly it is used in internal jugular, subclavian or femoral veins. Catheter related bloodstream infection is defined as the presence of bacteria originating from an IV catheter. It is one of the most frequent complications of central venous catheterization. It is most common cause of nosocomial bacteremia also. So, आपण माने समस्ते जेतेबेले एई प्रोसीजरटी हेउची सेतेबेले सबु क्लीन परिवेश रे स्टेरिलाइज मेथड रे एई कैथेटर देबा बेले डॉक्टर को सहायता करंतु. Then we will discuss now pressure sore. Pressure sore also is very worsen complication of the patient who is completely bedridden patient. So turn the patient every 2 hours. So side chain to be performed by the nursing officers by the help of 4th grade staffs there. Frequent repositioning, the position to be changed frequently. In between, a pillow under the tailbone, shoulders, heels and elbow to be provided to reduce the risk of pressure sores. If it is needed, apply moisturizers. Then manage incontinence, keeping the area clean and dry. এই ସବୁ पेशेंट मानकर कैथेटर दिया जाउथबो इंडोलिंग कैथेटर और फलिस कैथेटर आपण माने देउथिबे भी हेल्प भी करूथिबे. तेणु करके सही समय रे क्लीन मैनेजमेंट करंतु आ स्टेराइल मैनेजमेंट करंतु आउ सेही तांकर पेशेंट रो स्किन जेमती क्लीन थिबो आ ड्राई थिबो. Then use special pressure relieving mattress and cushions. Example air mattress and water mattress. आपण माने देखिछंती सब आईसीयू डिपार्टमेंट रे ए सब मैट्रेस अवेलेबल होची पेशेंट जोथरे कि आराम रे कंफर्टेबली सेठार रेस्ट नै परिबे एवं ए सब रिस्क जो प्रेशर सोर रिस्क टिके कम थाए. Then come to stress ulcers and gastrointestinal bleeding. Give early enteral nutrition within 24 to 48 hours of admission. It is the enteral feeding, the preparation or specialized liquid food that contains nutrition like protein, carbohydrates, lipids, vitamins and minerals which is give to the stomach through tube feeding. Then administer histamine 2 receptor blocker or proton pump inhibitors in patient with risk factors for GI bleeding. Histamine 2 receptor or H2 blockers. These are the medications which neutralize the hydrochloric acid of the stomach. For example, famotidine, ranitidine, pantoprazole, rabiprazole, etc. It reduces the over-secretion of hydrochloric acid in stomach and reduce the risk of GI bleeding. The last point is ICU related weakness. It is clinically detected in ICU units where the patient having weakness which is common in ICU and critically ill patients such as acute illness like COVID-19 or other cases. It creates novel form of weakness. Therefore, when the patient conditions become stable, no need for mechanical ventilation. As far as possible, shift the patient to general COVID unit. Therefore, early mobilization is better. जेते शीघ्र पारुचंती पेशेंट रो कंडीशन भल आड़क गले तांको आईसीयू रे न रखिकी शिफ्ट करवा उचित. Step 1 set of equipments like chair, trolley, bed, transfer belt, mobility aids, etc. The patient is going, you see from the picture, the patient is going from COVID ICU to general ICU unit. In step 2, calm and quiet environment. When you are shifting the patient, calm and quiet environment to be provided. In step 3, crash trolley. If there is no provision of trolley with the bed, and take crash trolley with the patient, which contains emergency medicines or injections. Step 4, monitor the progress of the patient closely. In between, you closely monitor the condition of the patient because patient is going or moving to the general unit of the COVID. You see, this patient from COVID hospital ICU unit, that is VIMSAR Burla, is preparing to shift general unit. So, आपण माने सबू कोविड हॉस्पिटल ले ड्यूटी करूछंती, आपणकर रेस्पॉन्सिबिलिटी, आपणकर सहाय्यर हाथ पेशेंट मान को बढ़ाइले पेशेंट माने जे अति खुशी रे और जल्दी आरोग्य हेई जनरल वार्ड को जीवे. आपण माने जेतेबे जनरल वार्ड रु पुणी भल हेई निज घर को फेरिबे, समस्तंकर आत्मा आपण मानकर भी बहुत आपण खुशी अनुभव करिवे. So I am thanking you and for your dedication work. Thank you again, nursing officers, for your dedicated service.